Welcome to Planet MicroCap. I'm your host, Robert Kraft, and joining me right now is Ray Stachowiak. He is the executive chairman of American Shared Hospital Services. It's a publicly traded company. The symbol is AMS on the NYSE American. And American Shared Hospital Services will be presenting at our upcoming investor conference, the Planet MicroCap Showcase Vegas, in partnership with MicroCap Club, taking place April 22 through 24, 2025 at the Paris Hotel and Casino in Las Vegas. For more information to register, to meet with Ray, to see his presentation in person, please register to attend at planetmicrocapshowcase.com. And with that, Ray, thank you for joining me today. How are you doing?
Good. I'm doing great, Robert. Thank you for inviting us to this video, and we're looking forward to participating in this year's conference.
Absolutely. It's great to have you, and we're looking forward to it as well. This is actually our first time doing an interview together, so would love to start off with can you start us off with that quick overview and history of the company?
Sure. So American Shared Hospital Services, we're a leading provider of stereotactic radiosurgery equipment and advanced radiation therapy cancer treatment services through our leasing or direct patient care services segments. Now, what does that mean? We purchase radiation therapy equipment from OEMs to either lease or for us to directly treat cancer patients with this wonderful advanced radiation therapy equipment. There are various forms of radiation therapy equipment, from linear accelerators that provide, I'll say, the bread and butter type radiation therapy treatment for cancer patients. There's gamma knives, which is the gold standard for treating brain tumors. It's much more precise, so it doesn't kill the surrounding tissue in the brain. And for even proton beam radiation therapy equipment, of which there are only about 40 centers in the United States providing this advanced form of radiation therapy. Why should you be interested in American Shared Hospital Services? We've been a public company for about 40 years. We've had some ups and downs, but we're really on track. We got a large amount of potential. We've recently been started to be covered by Zacks. But why interested in us? Well, we're profitable. We just reported our 2024 earnings. Earnings went up from 10 cents a share in 2023 to 33 cents a share in 2024. As a rough estimate, our stock price hovers around $3 a share, sometimes less, sometimes more, but that's quite a PE ratio for a young, growing startup or company that's been around but on track for a large amount of growth. We are growing. In 23, our revenues were just over 21 million. In 24, our revenues were in excess of 28 million, a 33% growth year over year. Our EBITDA also went up 8.2 million in 23, went up to 8.9 million in 24. If you look at the number of shares we have outstanding and the market value of our company at the end of last year and the year before, our market value at 2023 was only 15.2 million. An EBITDA ratio of 1.9 market value to EBITDA at the end of 23. In 24, our market value was 21.4, but a multiple of 2.4 EBITDA or market value over EBITDA.
So Ray, thank you for that full overview there. So I mean, what can you give us a little bit about your background prior to American Shared Hospital Services?
Sure. A little over 30 years ago, I bought a company that leased CT systems. 28 CT systems that I bought in 1994 that were generating $3 million a year in revenue with 3 employees. I grew that company to over 60 million in rental revenues, not equipment sales, in 2008, had good EBITDA, and over 150 employees by 2008. And I sold 50% of it to a great partner, family office in the Midwest here. I retired in 2013 after 19 years as CEO of the company. 5 years ago, during the pandemic, I had been serving on American Shared's board of directors since 2009. And in 5 years ago, in the first couple months of the pandemic, our 83-year-old founder decided to retire. And I had been on the board since 2009. I had been the only board member with prior CEO experience. I said, well, I think I can do this again. And over the last 5 years, I've led American Shared in capacity of executive chairman and or CEO during that time. I still own 50% of the company I founded, Shared Imaging. It's advanced to provide CT systems, MRI systems, and PET CT systems to healthcare systems in over 40 states of our great country. And I also have accumulated, I'm the largest shareholder at American Shared. If you look at our proxy statements over the recent years, I'm in excess of a 20% owner of the company and its largest shareholder.
Very good. All right, Ray, to close this out here today, from what you can tell us, what would you then say are some of the company's value catalysts and goals for the duration of 2025?
In 2025, we're going to grow our revenues both internally and by acquisition. We've got a new startup in Mexico. We have international operations in Mexico, in the country of Peru in South America, and in Ecuador in South America. And we have very good, strong potential for growth domestically and internationally. And we're experienced quite a transformation of our business model by providing cancer care directly to patients. We had been providing cancer care directly to patients in the countries of Ecuador and Peru and Mexico, but never had done it in the United States. We acquired 3 radiation therapy centers in May of 2024 in the state of Rhode Island. And we have obtained certificates of need to expand for a 4th radiation therapy in Rhode Island. And most importantly, to have a proton beam radiation therapy center in the state of Rhode Island, the only such center between the cities of New York City and in Boston. It'll have quite a catchment area and huge potential.
Very good. Well, Ray, with that, where can our audience go and find more information on AMS?
You can visit our website, ashs.com. We have a section for investors. All of our SEC filings are on that tab, as well as all of our press releases.
Very good. Well, Ray, thank you very much for joining me today. Really do appreciate it. Good luck. Stay safe, and I'll see you in Vegas.
Okay. Look forward to it, Robert.
Thank you.
Bye-bye.